Okay, guys, so we just got done talking about the abnormal behavior unit. So the likely follow-up there then is treatment. We're not just going to sit there and identify, here are specific types of illnesses that people can have, and then just leave you hanging on what can happen to help those individuals overcome. So until the 1700s, people suffering from severe mental illnesses were sometimes thought to be possessed by demons or evil spirits. And the treatments, and we'll use that word very lightly, to rid the person of the spirits were often severe or deadly. It often included chaining people to beds, bloodletting, which oftentimes led to death, severe beatings, submersion in ice baths where people were kept there until they either passed out or started to have seizures, induced vomiting to try to rid the person of the evil spirits. So even in the last 200 years, when we've become a little bit more enlightened, if you will, about the causes of mental illness, we haven't always given those individuals what we would consider to be humane treatment. In 1793, efforts were finally made to treat individuals that had mental illness with kindness and guidance, rather than seeing them as being someone who had something evil and wrong with them. Today, therapy is very different. The goal of therapy, therapy simply means treatment methods that are aimed at making people feel better and function more effectively. And some treatments are more successful with certain types of mental disorders than others. And we'll go through those here. So when it comes to treating psychological disorders, today we can group the two primary approaches of therapy into one of two very broad categories. Those two main categories are psychotherapy. Psychotherapy are your interactions between a trained therapist and someone who's seeking to overcome their psychological difficulties or achieve some type of personal growth. People tell a therapist about their problems. The therapist listens and tries to help them understand these problems or assist them in changing behaviors that are related to those problems. The other broad category is the biomedical therapy. This is when we utilize medication or some other type of biological treatment that acts upon the person's physiology. Most therapists do not fall neatly into one of these two categories. Most therapists are more eclectic in their approach. Eclectic means a blend of techniques. So they'll use some aspects from psychotherapy and some aspects from biomedical therapy as well. So the first thing that we're going to take a look at here is psychoanalysis and psychodynamic therapies, which were part of our insight therapies. They're often referred to as insight therapies because the main focus is understanding one's motives and actions, so taking a look into yourself. So we'll start off with psychoanalysis. Psychoanalysis was brought to us by Sigmund Freud. Please remember that Freud's underlying belief is that our thoughts go to our unconsciousness to prevent anxiety so that they aren't easily brought into conscious awareness, but those thoughts still impact our behaviors. You want to change your behavior, you need to address those thoughts. So the goal of psychoanalysis ultimately is to bring those repressed feelings into conscious awareness. You do so by relaxing the patient so that they feel free to explore their innermost feelings without fear of embarrassment or rejection. That's why Freud had people lay on a couch. He felt that it was more relaxing, it would make them feel more dependent and childlike, making it easier to get them to get to those early childhood memories. And he had the added benefit, if he sat at the head of the couch behind them, they couldn't see his reactions whenever they spoke. So the techniques that he used, one, he used dream analysis. We've talked a little bit about dream analysis already. Another of the associations that he used was free association, which was where the client was to say whatever comes to mind. The goal, revealing that repressed information. So the patient had to feel as though they could do so without fear of being negatively evaluated or condemned. Freud felt that repressed impulses would break free in loose associations, slips of the tongue, etc. The thing that kind of got in the way of this, if you will, is resistance. He didn't feel that a patient would just willingly talk about everything in their unconsciousness, that it would eventually get to a point where they would be unwilling to talk about certain subjects. And so you would have to find a way to break around that resistance. One way in which you would do that is through interpretation. That's the analysts themselves noting significant behaviors and providing their insight into that meaning. The problem with this is that it's very subjective on the part of the therapist. They're choosing what aspects of what the patient is saying to pay attention to, and they're providing their interpretation. And there's nothing to say that their interpretation is the accurate interpretation. You also risk transferring. Transferring is when the patients transfer of emotions that they link with other relationships to their feelings towards their therapist. Eventually, Freud felt that transference would happen, that the therapist would become a symbol of parental authority figures from the past. The thing we have to remember with psychoanalysis is that it's not supported by scientific research. Few psychoanalysts today use Freud's original method. The couch is gone, patients are now referred to as clients, and the therapist is much more directive and less passive in the entire process. Today, psychoanalysts use what's called psychodynamic theory, still strongly influenced by Freud. It's kind of today's version of psychoanalysis. There's no longer the focus on the id, ego, and superego. There's no longer the focus on those psychosexual stages of development. However, we do still view, sorry, my dog is chewing on her chew toy, still do view the individuals as responding to unconscious forces and childhood experiences and help them to seek self-insight. It does still focus on unconscious motives and the importance of childhood as experiences that are fodder for what shapes us as to who we are now. The other type of insight therapy is the humanistic therapy. Humanistic therapy does not focus on unconscious motives. Instead, it focuses on things that are in the conscious, subjective experience of emotions, and people's sense of self and their more immediate experiences rather than childhood experiences. It also emphasizes the importance of choices and the potential to change your behavior. So humanistic theory also tries to reduce inner conflicts that interfere with personal growth, but the difference between a humanistic therapy and a psychoanalysis or psychodynamic therapy is it aims to help people become more self-aware and self-accepting. The focus is on growth, not curing the illness. Don't care about like what happened, like why you are where you are right now. The goal is to get you to a better place in the future. The focus is also on taking responsibility for one's feelings and actions, not uncovering some type of hidden determinant. Conscious thoughts are more important than unconscious motivators, and the present and future are more important than the past. One of the main individuals that we associate with the humanistic theory in general, as well as the therapy surrounding the humanistic theory, is Carl Rogers, and we talked about him earlier. It's actually now not even called client-centered therapy, it's now called person-centered therapy. It's a little bit more neutral, if you will. So the client leads the discussion, the therapist neither judges nor interprets. The goal, according to Rogers, is that the therapist accept and understand the client. Rogers believed it was the job of the therapist to provide that unconditional positive regard that has clearly been absent from the troubled person's life and to help them recognize the discrepancies between their real self and their ideal selves. The real self is how you act and who you are. The ideal self is who you want to be and how you wish to act. Remember, he felt that the greater the discrepancy between those two entities, the more troubled a person would be. Unconditional positive regard is that caring, accepting, non-judgmental attitude that helps clients develop self-awareness and self-acceptance. It's not saying that you're perfect and that you never make mistakes. It's saying, I will accept you even if you are imperfect and you do make mistakes. The person really does most of the work in person-centered therapy. The therapist is very non-directive, is really just kind of like a sounding board. So there's three key elements that Rogers felt were imperative in order for this client-therapy relationship to work. The therapist has to be authentic. They have to truly tolerate the person's differences without judgment. They have to exhibit that unconditional positive regard, so they have to respect the individual for who they are, and they have to have empathy. They have to see the world through the eyes of the person that they are working with. He also felt that active listening was absolutely essential for this type of therapy to work. Active listening is empathetic listening in which the listener echoes, restates, and clarifies. Not only is this type of listening really valuable for a client-therapist relationship, it's valuable for any relationship, friendship, parent-child relationship, romantic partner relationship, etc. It's making sure that you really are listening to what the person says and understanding what they're saying, because sometimes the words that someone says aren't necessarily what they actually mean. So how do we go about active listening? We can paraphrase. After someone talks to you, you summarize in your own words what it is you think they are saying. You also ask them to clarify, encourage them to say more. Things like, can you give me an example of a time when you felt like this, or things like that. And then reflect their feelings, like state the emotion that you think they are trying to express. That sounds infuriating, and they will correct you, hopefully, if you are wrong. The problem with the humanistic theories, very much kind of the same as the problem with the psychodynamic theory. There's little experimental research to support the basic ideas on which humanistic therapy is founded. But the humanists have always favored case studies over experimental research, so they're okay with that. It also requires that the client be intelligent, verbal, and able to express their thoughts, feelings, and experiences. So it's not suited for everyone, and it really doesn't have a lot of practicality when it comes to severe mental disorders like schizophrenia. So that's it for Module 70. We will do Module 71 next time.